In 2013, the government of Indonesia and the United States Millennium Challenge Corporation entered into a 5-year compact designed to encourage economic growth, enrich life, and reduce poverty. From 2013 to 2018, the compact oversaw a variety of projects in support of these goals. Foremost was the Community-Based Health and Nutrition Project, which addressed issues of childhood stunting and improved health indicators for pregnant women and young children. In order to measure the project's full impact in as accurate and detailed a way as possible, the MCA Indonesia Monitoring and Evaluation Team stepped forward in partnership with University Research Corporate, URC. URC developed a new all-inclusive monitoring program that creates concrete solutions for extant gaps in nutrition and stunting data by making high-quality data readily available. This new program was implemented across 100 Sentinel sites or sub-districts in 11 provinces nationwide. The program had a number of objectives, including developing an online database and desktop application able to generate relevant, reliable, and real-time data, creating training modules for midwife data collectors. Additionally, the program oversaw the installation of this application onto the midwife's MCA Indonesia laptops, the migration of existing data from health facility records to the online system, the maintenance of the database data, as well as providing continued user assistance regarding the generation of data reports for MCA Indonesia during the data collection period. System development. In order to comprehensively manage data in real time, URC developed a monitoring system that compiles data input, processes, and output into a single online platform. This system, called a Demographic Health Surveillance System, DHSS, unifies targeted population statistics with key statistics of interest, including individual health services, demographic events, and health events. Robust but simple, the DHSS system has proven beneficial to the MCA Indonesia Monitoring and Evaluation Team and is easily adaptable for future opportunities. This system has the potential to strengthen government monitoring systems with reverberating impacts in data availability and utilization in Indonesia. Data collection. The DHSS app's data can be divided into 5 categories. 1. Rapid household census. 2. Cycle updates of household demographics. 3. Record of routine service statistics. 4. Household socioeconomic data collection. And 5. Sample surveys or studies of specific health topics. Field facilitators and midwives both receive downloads of the DHSS app onto their laptops. Health card data for thousands of mothers and children were migrated into the app, allowing local midwives to easily pull up their files and add new information as needed. Rather than adding to midwives' workload, these features streamline efficiency, allowing midwives to spend less time on the procedures of their job. Because the desktop app functions offline, midwives can input health service data even without web access and sync the app with the point-of-use unit later once service is restored. Field facilitators use the DHSS app largely for cyclical data collection, including census, demographic events, and health surveys. Additionally, the DHSS app has allowed facilitators to easily geomap locations as they collect data. This project supports MCA Indonesia monitoring and evaluation efforts to report on several key indicators. These include village participation in nutrition (SBCC) activities, coverage of iron and folic supplementation among pregnant women, coverage of micronutrient supplementation among children, household hygiene and sanitation behavior, healthcare-seeking behavior. Additionally, the DHSS system is particularly useful for monitoring the health of women and young children, especially regarding maternal and child immunization status, contraceptive use among reproductive age women, maternal anemia status, maternal anthropometric status, child anthropometric status, prevalence incidence of morbidity among children, diarrhea, respiratory infection, worm infestation, maternal and early childhood mortality. Practically, this means that health service providers and researchers are now able to map child stunting geospatially and track over time how well the issues of stunting and anemia are being addressed. This also means that health service providers and researchers can observe a baby's nutritional status and compare it to the status of the mother during pregnancy, allowing us to collect additional data on how well project interventions are functioning. Data display. Making our data available and easy to access through summary reports and dashboards was a first priority for URC. Our data programmer optimized our platform for users, allowing them to easily form queries. On the front-end interface, the platform displays indicators. On the back end, our database framework contains multiple interlinked categories of data. When a user makes a query, the necessary data is pulled from the back-end database and displayed in tables, graphs, or maps on the interface. This system is currently online and features an executive dashboard that allows visitors to study nutrition statistics and longitudinal trends for participating villages. Example of application at the village level. The data collected under this project was used at one sub-district in West Java, Serengas, in a local forum called Mini Lokakarya, to support planning and budgeting. Attended by sub-national government officials from different units, the forum served as an avenue to determine subsequent programming and resource allocation to address stunting. Previously, due to a lack of data reference, programs focused on providing supplement food only, without applying data to understand the local needs. The stakeholders at Serengas were able to draw on all indicators related to stunting, facilitated by a local partner, to determine the most crucial gaps to address and the budget allocation. Sustainable application. MCA Indonesia and URC work with the Ministry of Health and Ministry of Villages to tailor the DHSS app to their needs. The DHSS application complements the Ministry of Health's extant systems in two ways. First, by linking population and health services data, and second, by recording population-level conditions and demographic events longitudinally. This project was driven by strengthening the interaction of the three crucial functions of public health: